This is case of the day, one case every day from Monday to Thursday, and completely created manually with no AI. Today is the 142nd case of a TFCC injury, or the triangular fibrocartilage complex. So this was a 46-year-old with trauma and ulnar-sided pain with foveal tenderness, and I'd like to thank my colleague Chinmay Mehta for doing the primary read here. But if you start from volar to dorsal, then you see this volar radioulnar ligament, which is fine. In fact, you can see the ulnocarpal ligaments, the ulnotriquetral and the ulnolunate, which are fine. This is the PD fat sat, and that is a thin section 3D PD coronal image, which shows the ligaments really well. Then we see a large tear, so you can see the radial attachment on the cartilage, then a large tear centrally here. And as you start, you can see the normal meniscal homologue, a lot of fluid here, and then there's a foveal side or a proximal laminar tear, whereas the distal lamina or the styloid attachment seems fine. You can again see the meniscal homologue and the ECU very well here. And then as we go further dorsally, the dorsal radioulnar ligament is partially torn here, and a lot of ill-defined thickening, etc. If you look at the sagittal images, you can see the ulnolunate ligament very well here, but the dorsal radioulnar ligament is thickened and ill-defined, and in fact there's a little cystic lesion in the ulnar styloid as well. So it's a subacute, acute injury, subacute injury, and perhaps there's a chronic component to this as well. So if you were to summarize this, this is a complex tear. There's a central tear plus a foveal side proximal laminar tear and a dorsal radioulnar ligament tear. If you look at classification systems, you have the Palmer classification. We first have to differentiate traumatic from degenerative and then figure out which one it is. There's the Cup classification and many others. But we normally just describe the lesion without actually mentioning a classification and leave it to the hand surgeon to figure out what to do next. As far as resources are concerned for understanding anatomy and pathology, these two papers are easily available and are wonderful. And this is by Matthew Skalski, and he's an amazing illustrator. And I'll show one of these here. And this article is very nice too. But I think the best exposition of anatomy is Christoph Acton's video. And I've got a link on the top right, which you can go straight to, where he uses a 3D image to show the anatomy well. And in fact, I just revised my anatomy looking at this. And so I think that's worthwhile as well. Now this image is from Matthew Skalski's paper, and you can see the normal anatomy here, the radial side that attaches to the cartilage. Then you have the triangular ligament attaching to the fovea and the styloid process, the meniscal homologue, the ECU, the subsheath, and the ligamentum subcruentum, which is the fibrous tissue between the two laminae. And if you look at, so I've got a normal scan here on the side on the right, and that's the abnormal one. You can see the volar radioulnar ligament. How do you know it's the radioulnar ligament? It attaches to the bone instead of the cartilage. So when you see this dark band here, you know that's the volar radioulnar ligament. And then here is where we saw the large central tear, but that's normal here, and this is the normal um, um, ulnar side of the ligament with the foveal, the proximal and distal laminar bands, or the foveal and the styloid components. You can see those really well here too, whereas here we see the tear involving the proximal lamina and the foveal ligament. And then as we go distally, you can see here the normal dorsal radioulnar ligament normally, whereas here it's partially torn and contused. So an understanding of anatomy and a methodical evaluation will allow accurate delineation of TFCC anatomy and injuries. And I think if I'm going to be constantly doing this, then maybe over the next couple of years I'll have a couple more cases discussing different types of injuries and perhaps a little more understanding of the anatomy. Rat, rat, rack, protect in January, my WhatsApp channel, and thank you so much for viewing this.